Hi, my name is Emily Cornett, and today I'll be presenting on the diagnosis to treatment of Lyme disease. So, I'd like to just give a quick refresher of what Lyme disease is from my last presentation. Lyme disease is an infectious disease that is caused by the Borrelia burgdorferi bacterium. This bacteria is spread by ticks, and once an infected tick latches, it bites into the human skin, and the microbes travel throughout the bloodstream. If left untreated, Lyme disease can spread to the joints, heart, and nervous system. A few symptoms of Lyme disease include pain, stiffness or swelling of the joints, pain in the muscles, overall fatigue, fever, headache, and usually a bullseye pattern rash. So, as for the overview in the news, media, and articles, I decided to focus on Justin Bieber. Just a few months ago in January, he reported being diagnosed with Lyme disease. And I just thought it was interesting. He shared that many people accused him of looking like he was taking drugs, but in reality, he was just suffering from symptoms of Lyme disease. And I think that these accusations are very telling regarding the amount of strain Lyme disease has on the body. Justin appeared this way because he was experiencing headaches, fatigue, muscle pain, and other symptoms that would cause him to look different from his normal self. And Justin reports his journey being one that has lasted a couple of years now, meaning he most likely developed PTLDS, which means post-treatment Lyme disease syndrome. I did not go over this in my last presentation, but having PTLDS means that someone experiences symptoms of Lyme disease for more than 6 months after they receive antibiotic treatment, and the cause for this is unknown. According to the CDC, there is no proven treatment for it, although in most cases it usually gets better with time. How is Lyme disease diagnosed? So, when symptoms for Lyme disease are present, the first thing to consider is the likelihood of the patient being exposed to the Borrelia burgdorferi bacterium through ticks. So, if the patient complains of symptoms during the time of year when the ixoid tick species thrives and lives in an area where they are present, it's safe to say they should move forward with laboratory testing. It is also important to consider that there may be a possibility that it could be another illness that causes similar symptoms. So, the main thing to kind of look out for is the bullseye pattern rash, accompanied by other symptoms like headaches, fatigue, etc. But sometimes the rash is not present, or it is in a part of the body that is difficult to locate, which sometimes can cause a misdiagnosis. Also, keep in mind that there's no way to simply check if someone has Lyme disease. There are only antibody tests that can be performed. And as I'm sure you know, antibodies start to develop after a few weeks of having Lyme disease, which is why Lyme disease is so hard to diagnose, especially in the early stages. If the physician determines that there is a risk for Lyme disease, they will most likely take a blood sample and perform 1 or 2 tests, depending on the results of the first test. This first test is an enzyme-linked immunosorbent assay test, which is also known as ELISA. And it is used to check for past or current infection, and it checks for antibodies made when the body's immune system responds to Borrelia burgdorferi. This test is not entirely reliable, though, because it can sometimes provide false positive results. And this is because the test is very sensitive, which means that almost everyone who has Lyme disease, and even some that don't, will have a positive result. And the other test is the Western blot test. This test is conducted if the ELISA test is positive in order to confirm the diagnosis. And it is very specific, meaning that most of the time it will only be positive if a person has truly been infected. Also, the Western blot test is more specific for the Borrelia burgdorferi bacteria than the ELISA test. So, a negative Western blot test usually indicates that the ELISA test was a false positive. The Western blot test detects antibodies to several proteins to the Borrelia burgdorferi, and there are 2 kinds of the Western blot tests that are used. The IgM and the IgG. The IgM antibodies are the first antibodies to be produced in the body in response to an infection. And these antibodies are larger than the IgGs, and when they are present in high numbers, this may indicate a recent or new active infection. The IgG antibodies are produced once an infection has been going on for a while, and may even be present once the infection has gone away. So the presence of IgG antibodies to an organism accompanied by a negative IgM test of the same organism indicates that that person was exposed to the organism at one time and has developed antibodies to it, but does not have a current infection. So people who test positive by IgM but not IgG should have the test repeated if they still show symptoms. And if they are positive only by IgM and have been sick longer than 1 month, then they likely showed a false positive result for Lyme disease. So how is this disease treated? Antibiotics are the main form of treatment for Lyme disease, especially for the early stages. And these include doxycycline for adults and children older than 8. And amoxicillin or cefuroxime are used for adults, younger children, and pregnant or breastfeeding women. It is recommended that these treatments are used 14 to 21 days, but some studies suggest that 10 to 14 days is equally as effective. Another form of treatment for Lyme disease is intravenous antibiotics. This is usually recommended when the disease has affected the central nervous system, and treatment usually lasts 14 to 28 days. This method is more effective in eliminating infection, but it also causes various side effects, such as lower white blood cell count, mild to severe diarrhea, or colonization or infection with other antibiotic-resistant organisms that are unrelated to Lyme disease. So, while these forms of antibiotics have been the standard treatment for Lyme disease for decades, researchers have very recently found and tested a drug that kills off Borrelia burgdorferi with few side effects. So, I was looking online and I found this article that just over a month ago on March 12th, Stanford Medicine published an article addressing their findings. They stated that current antibiotics kill off the Lyme disease infection, but it doesn't work on 20% of people with Lyme disease, and those people have symptoms that continue to persist. And so a new study Stanford scientists have conducted show that the drug islosilin completely kills off the bacteria at the onset of the illness. And a man named Jayakumar Rahadas, who is the assistant professor of medicine and director of the Biomaterials and Advanced Drug Delivery Laboratory at the Stanford School of Medicine, states that the compound is amazing. It clears the infection without a lot of side effects, and he says we are hoping to repurpose it as an oral treatment for Lyme disease. So their team has been screening potential drugs for 6 years, and they have screened almost 8,000 chemical compounds and have tested 50 molecules. And islosilin was shown to beat out a total of 7,450 compounds because it is the most effective in killing Borrelia burgdorferi, and it also causes fewer side effects. And so currently it is not on the market, but it is patented as a treatment for Lyme disease, and an oral form of the drug is currently being developed. And researchers plan to conduct a clinical trial soon, so it seems like huge advancements are being made, which I think is incredible because Lyme disease is obviously a very tricky disease, and it is just, good to know that there will hopefully be a cure out there on the market in the near future.